Hey everybody, it's Adam Farkas. Welcome to another edition of ODwireTV. And today we're going to be talking all about multifocal lenses and your practice and how you can use multifocal lenses to build your practice. Before we get started here, it's a bit of disclosure for you. This episode of ODwireTV is sponsored by Alcon, and our guest today, Dr. April Jasper, has been compensated by Alcon for participating. And with that said, let me tell you a little bit about Dr. Jasper because she's an expert in multifocals. She's with Advanced Eyecare Specialists in West Palm Beach, Florida, and a significant part of her practice has to do with fitting multifocal lenses. So I can't think of a better person to talk to us tonight about not only the clinical benefits of multifocal lenses to her patients, but also how you can use the lenses as a practice builder. So April, thank you so much for being here tonight.
You're welcome. It's great to be here.
So why don't you talk to us a little bit about how multifocals have made an impact in your patients' lives and what it's meant for your practice as well?
You know, multifocal lenses are not only important to my patients, but I wear them as well. So it's been really cool for me to, I guess the one part about getting older is I get to actually live the experience of what my patients are living, and it really has shown me how important it is as a patient. But I think the one thing that we also need to remember as practitioners, and I have again had it come home to me, is that fitting multifocal contact lenses represent a big opportunity for our presbyopic patients to create that entire happiness and experience for them. It gives them something that can meet their unique visual and lifestyle needs. Because most patients that are presbyopic don't want to be tied to a pair of reading glasses. They're busy professionals, they have active lives, and they're image conscious. They want correction that makes their high vision standards, but doesn't make them feel old.
No, absolutely. I mean, April, you know, I'm a Gen X. I'm one of those that is, moving into the presbyopic range. And when I felt like I was aging out of my contact lenses, it was quite a depressing thing. I've been wearing them my whole life. And so, I made the move to multifocals because to me, it was leaving contact lenses was kind of unthinkable. And I think that there's an entire demographic now that feels similarly. They really don't want to move out of their lenses.
I agree. And I think that they start to have that thought process occur earlier than what we might think. And so what it's done for me, Adam, is it's helped me to understand that I want to start talking about presbyopia before my patients start to experience those telltale symptoms. That way they understand what to expect. They know that contact lenses are a great option, and they know that even when those moments happen, when that time comes, that there will be a lens for them. What's really cool about that too is that when you do what's right for your patients, it tends to be good for your practice.
Right, and let's talk about that for a second, because now we have access to data that can really show you, or show all of us, how this can really grow your practice. So you want to speak to that data a little bit?
I think the data has been really interesting to study myself. Alcon has reviewed millions of data points from over 500 locations across the country. I might have guessed some of this in the past, but now what's really clear from these data points is that per patient revenue is higher for patients who wear contact. What's more is that difference is even greater when we focus on multifocal contact lens wearers. The mean per patient revenue is more than $1,200 for patients who wear multifocal contact lenses plus glasses versus just under $500 for patients who wear glasses only. That's a big difference. And in the past, we didn't have these data points to be able to show what maybe some of us had been thinking was true.
Right. It's a big difference in revenue. But what's funny is just before we came on here, I was laughing with my father, who's sitting here off camera. In his day, when he started fitting contact lenses in the 60s, he's sort of seen it all, and he was there at the beginning of multifocal lens development. And back in the day, fitting multifocal lenses was a huge challenge, but as technology has advanced, it seems like it's become a much easier process.
It really has, and if you think about a day in the life of an optometrist, we don't have a whole lot of time. There are patients to be seen. They're in a hurry these days as well, and so we need to have a simple process. But that's why I fit Alcon's multifocal contact lenses. With Alcon's multifocal contacts, I have the choice of 3 lenses with 2 replacement schedules, daily or monthly, and then all of them have the same multifocal design. The precision profile design is really important because it supports seamless vision at all distances. And given that unique nature of their lens design, Alcon multifocal lenses are also fit with a unique process that turns out to be really simple. We call it the 3-2-1 advantage.
Right. Now, fitting only requires 2 steps. Is that right?
That's right. And the result of following those 2 steps is clear. When the Alcon multifocal fitting guide is followed, you can see on the slide here that 80% fit success is achieved with the first lens and 96% fit success with 2 lenses or less per eye. I know I personally have had that experience in my practice, and it's really fun again to fit multifocal lenses because a patient comes in, I can put them in lenses. I fit 4 patients this morning, and a patient comes in, I put them in the lenses, they see well immediately, and they're shocked most of the time at how much this can change their lives.
So just speaking practically, you mentioned before that Alcon has 3 lenses that you can choose from. So do you sort of have a go-to that you start with the patient?
I do. I mean, in most cases, I really want my patients to go into a daily disposable lens because they're convenient and the benefits are amazing. Within the Alcon multifocal portfolio, I really want to move towards Dailies Total 1 multifocal lenses. They've got the daily replacement schedule, the precision profile design, and it combines Alcon's unique water gradient and smart tiers technology to provide exceptional comfort. For me, comfort is key. I think, of course, comfort and excellent vision are just as important, though, for monthly lens wearers. So if you have a patient that wants to have that monthly modality or a monthly lens, then I recommend Air Optics plus Hydroglide multifocal lenses. They feature the same optical design plus the Hydroglide moisture matrix for long-lasting lens surface moisture and all-day comfort.
One question I had for you is sort of the economics of this. Is this an economic issue for a lot of patients when they decide which modality to use?
I think that once a patient experiences Dailies Total 1 multifocal lens, 9 out of 10 in my experience want to stay with it. The comfort to them is key. And I think that in my practice especially, patients are willing to pay what might be a little bit more for that additional comfort and convenience of being able to put a new lens in every day.
So, Alcon has developed a lot of materials to help with this fitting process. One thing that they've created is a simple training tool that can help practitioners understand these steps to fitting the lens properly.
I love it. It's a brief video, but it demonstrates how to fit Alcon multifocal contact lenses by walking through an example fitting. This video is, like you said, one of several excellent resources from Alcon, and I recommend this to practitioners who are looking to either start fitting or fit more Alcon multifocal lenses.
Right. So let's get down to brass tacks here and maybe go through a sample fitting so we can see how it all works.
Sure. So successful multifocal fitting begins with just getting to know our patients. We want to know what their needs are. We want to assess how they can benefit from multifocal lenses because we want to be able to have a conversation with them and help them to see how this is going to solve their problems. As you'll see in the first part of the video, we're introduced to a patient who is a good candidate for multifocal contacts. He's an early presbyope, beginning to experience blurring of his near vision. He's already a contact lens wearer and does not want to start relying on reading glasses. Sounds like you, Adam.
Yep.
All of these factors make him a good candidate for multifocal lenses, and from the practitioner's perspective, help improve the likelihood of a successful fit.
In our case example, we have a 44-year-old patient who currently wears spherical contact lenses and has started to notice some blurring of his near vision. He's a busy professional who frequently uses a computer but is also active outside of work. He likes wearing contact lenses because of the appearance, flexibility, and peripheral vision benefits. He's not excited about the idea of wearing reading glasses, making him a good candidate for multifocal contact lenses.
As I mentioned earlier, the key really to a successful fitting is following the Alcon multifocal fitting guide. This starts with getting a new spectacle prescription every time. Now let me say that again. This starts with getting a new spectacle prescription every time. It really is important that regardless of whether you're fitting a patient for the first time or refitting them in a different Alcon multifocal lens material, you start fresh so that you have that spectacle prescription, which is your baseline, correct. Next, you determine the initial contact lens power using the vertex corrected, most plus, spherical equivalent distance prescription, and then you add a quarter diopter plus for each eye. You then follow by selecting the lowest acceptable spectacle add, boy, that's hard to say, low, medium, and high, whichever one is the right one, using the simple chart in the fitting guide. So let me back up and make this simple. Once you have the new spectacle prescription, then what you do is you determine that initial contact lens power, again, vertex corrected, most plus, spherical equivalent. Then you add plus a quarter for each eye, select the lowest acceptable spectacle add, and then all you do is look at that simple chart in the fit guide to pick which one it's going to be, and you're good. You have your initial lens.
Got it. So now you've picked the power, you have the lens on the patient, and they're in your office. What happens next?
And I'm really picky about this, and part of the reason is because it says to be in the fit guide, but I've also become picky about it because I've seen it work, and that is I give my patients 5 to 10 minutes to give the lenses a try outside of the exam room. And I know some of you are thinking, I don't know how that's going to work, April, and I'm here to tell you it will make all the difference in the world. I want them to test the lenses looking at real-world objects. I tell them to go outside, look at things far away. I basically say, go out and look at the real world, and then come back inside, walk around the reception area, get your phone out, look at a couple of emails, and see what you think. Doing this gives the patients an opportunity to see how the lenses are performing during distance, intermediate, and near vision tasks, but also it just gives them a chance to get excited. By the time they go out and do that, come back to see me, they're so excited, they're so happy that it's just a fun moment when they come back and we celebrate together.
Absolutely. And in fact, when I was fit, my OD kicked me out into the optical and said, I want you to stare out those windows at these road signs. And he used the road signs outside his office as a common sort of landmark for distance vision. Then after a few minutes, he said, now get in front of your phone and use that for a while. Then come back and let's talk about it.
Yeah, that's perfect.
And so why don't we take another look here at the training video just to sort of see how this works in practice.
Recall that we start by determining the patient's vertex-corrected, most plus, spherical equivalent distance prescription. In this case, the exam gives a sphere prescription of right eye minus a half diopters with a plus 75 add, and left eye minus 2 diopters with a plus 75 add. Following the fitting guide, we select the lenses by adding a plus a quarter diopter for each eye, giving us right eye minus a quarter diopters low and left eye minus 175 diopters low. We select the low add lens given that it covers patients needing up to plus 1 1/4 diopters of add power. After applying the lenses, we give the patient 5 to 10 minutes to experience the lenses outside of the exam room before coming back to assess their visual performance.
Okay, so after completing the initial lens selection and then giving the patient the opportunity to try their lenses out, what's the next step?
After giving the patient a chance to actually let the lenses settle and see what it's all about, you want to bring them back and have a distance over refraction done. So the way I do that, and the way, as you see in the fit guide, that is, we're told to do that, is to perform this distance over refraction on each eye separately, but both eyes open. Using handheld lenses, you add plus a quarter in plus power, quarter diopter steps in front of one eye, and then the other. Through intensive research, Alcon developed and refined its multifocal fitting process to maximize success, and this addition of plus power during distance over refraction is really key to getting the fit right. The reason plus power is added at this stage comes back to that design. The precision profile design adds minus power in the periphery of the lens, and that additional minus power can often result in a plus power over refraction at distance, and also means that plus power can be added without affecting distance vision. So when you perform the distance over refraction, again, you add plus power in quarter diopter steps until the patient says it's worse, or until they report a decline in distance vision. If you watch in the video, though, that Alcon's created, you'll see exactly how this is done.
The next step is to perform a distance over refraction with both eyes open using handheld lenses on each eye separately and by adding plus power in a quarter diopter steps until the patient reports a decline in his distance vision. Beginning with the right eye, we add plus a quarter diopters and the patient says that his distance vision has gotten worse. So no change is needed, and the final right lens is minus a quarter diopters with a low add. With the left eye, we add plus a quarter diopter, and the patient reports no change in his distance vision, so we add another plus a quarter diopter. In this case, he reports that his distance vision is worse. Given that the first plus a quarter diopter added did not change his distance vision, we adjust the prescription of the final left lens to minus 150 diopters with the low add.
Next, you go ahead and verify the results of the overrefraction binocularly. Again, have the patient look at real-world objects at distance and near through the handheld lenses, and then I have them look around the room. I have them pull out their phone, try their distance, and look at their phone for near vision. And if any modification to the lens power is required for either eye based on that overrefraction, go ahead and have them apply the new lenses, keeping the add the same. Whatever it is, whether it's low, medium, or high, keep it the same. Then you just dispense those trial lenses and have the patient schedule a 1-week follow-up visit. That's really all there is to it.
We verify the result binocularly by having the patient look at real-world distance and near objects through the handheld lenses and apply the new lenses based on the overrefraction, keeping the add the same. For this patient, the final prescription is right eye minus a quarter diopters with a low add and left eye minus 150 diopters with the low add. His vision is adequate, so we dispense the lenses and have him schedule his 1-week follow-up.
Wow, so that is fairly straightforward. I mean, it seems like we spent more time describing the process than we would having the patient in the chair.
It is amazing. It's definitely what I experience in my practice. By following Alcon's Fit Guide, amazingly, you can make multifocal fitting very straightforward, which helps ensure success. And really, my goal is get this right the first time, get patients into the lenses, and let them have a wonderful time experiencing how life-changing they can be.
Right. So now you've got the patients, they're in their trial lenses, they're out the door, and they're at home. What kind of advice do you give them once they've gone home with their lenses?
And that's an important part. You know, you really want to set their expectations, not just in what to expect for their vision, but also in what they can do to help get the most out of their contacts. So to do that, the first thing I tell them is that this is an adaptation period. I mean, they're going to get better. Everything may not be perfect at first, but they can expect improvement even over the next 5 to 7 day trial period. I also tell them to wear their lenses in real world settings, at home, at work, or anywhere else that they usually go as much as possible, and to use both eyes for all visual tasks. And I jokingly tell them, I mean, that's the way we live. That's the way we should experience our lenses. All of this helps that adaptation process along. And really, in my words, what I tell them is, today is the worst day you'll ever have in your lenses. And it's funny, patients look at me like I'm, saying something foreign at first. And then I smile at them and say, think about it for a moment. Every day over the next 5 to 7 days, you will probably expect or experience improvement. So today's the worst day you'll ever have with them. And then they look at me and go, they actually respond back, wow, that's incredible.
Right. And any other tips you can offer, not just mature presbyopes, but emerging ones as well? I'm looking for all the tips I can get.
Well, one of the things I make sure that they understand is that they may sometimes have to use additional light when looking at things up close, like when they're reading. And then on the other hand, I tell them it's really important you wear your sunglasses when you're outside so that will help with your distance vision. And I kind of like this anyway because it's a great way to start talking about UV.
And so let's say that, the patient's done all this, they've gone home, they've trialed their lenses, you think the power is not quite right, so they come back to you and you get them in the chair. What's next in the process?
When a patient comes back for that follow-up visit, and even before they leave, I tell them that when they come back, that we may need to make an adjustment. And when they come in to the visit, I tell them these kind of tweaks are part of getting the fit right for their individual needs. And, as practitioners, what we want to know that when a patient comes back, we'll, again, have a simple process to be able to verify that they're in the correct lens so that they'll be able to move on in purchasing their lenses.
So, if you're a practitioner starting out fitting Alcon's multifocal lenses, and many people in the audience will be, right? This will be their first exposure to the family of lenses. What kind of advice would you give?
The first thing I would tell them is what I know they've heard before, but hey, now you can listen to it from April and know that I'm not going to tell you anything other than what's worked in my practice, and that is follow the Alcon Multifocal Fitting Guide every single time. We have a tendency to think back to 20 years ago, even 10 years ago, to when things were different. Alcon's gone to the trouble to verify the fitting guide to make sure that they're giving us the information that works. And in my experience, following the fitting guide has led to high rates of fitting success. The second thing I would tell practitioners and tell my colleagues is talk to your patients. Start the conversation about presbyopia early. That way, when it's time to fit them in multifocal contact lenses, they've already heard about them. They're already coming in thinking, I'm not going to be taken out of contacts. I'm going to have another option. So I set their expectations. I give them tips once I fit them to help them succeed with their lenses. And in my own practice, this type of encouragement has made a huge difference in helping my patients get the most out of their lenses. The last thing I would tell patients, and tell doctors actually, is to use the unique set of resources that Alcon has developed to help you have success. I tell doctors the most important thing is take advantage of the resources that Alcon has out there. One of those, the training video that you already saw and we've discussed today. You also have in-person training opportunities. Take advantage of those, and you can have your staff be a part of those as well. And the Alcon Multifocal Toolkit is really cool because it includes all kinds of useful practice resources. One of the things in it is a patient vision questionnaire that will help everyone in the practice to become part of the team to help identify candidates for multifocal contact lenses. There's obviously the fit guide in there. And then there's a tear-off sheet that has helpful tips for patients new to multifocal lenses. It'll tell them things such as you may need light when you go outside and light when you're reading, and wear your sunglasses when you go outside. But the big takeaway here is that successful multifocal fitting can be a lot easier than you think.
Great. And by the way, everyone, you can sort of see I'm holding up the fit guide right now and the toolkit that contains the fit guide and all those other resources. You can see what it kind of looks like here. So you can check that out, and it's definitely an incredibly helpful resource. And you can get that, I'm sure, from your Alcon rep. I think I have that right, April?
Absolutely. They will have access to that. Just give them a call, text them right now.
Great. Well, April, do you have any sort of parting thoughts for us?
I'll tell my friends and colleagues that are listening the same thing somebody told me a few years ago, and that is the only way you're going to really believe me and know that it's true is to get out there and do it. So take the next 10 patients that would fall into the parameters that would work with these lenses and fit them, follow the fit guide, and enjoy the success.
Excellent. Well, that is a great piece of advice. So April, thank you so much for being with us today.
Thank you, Adam.